Everyone. So the topic we are covering today is lung cancer. So we have two broad headings of lung cancer. We have the non-small cell lung cancer and the small cell lung cancer. So first category is non-small cell lung cancer, and then we have small cell lung cancer (SCLC). Within the NSCLC, that is non-small cell lung cancer, we have adenocarcinoma, the most commonest type, which is 40%, squamous cell cancer, and large cell cancer. So non-small cell lung cancer, small cell lung cancer. Within non-small cell lung cancer, we have adeno-CA, we have squamous cell cancer, we have large cell cancer. Adeno-CA most common 40%, squamous cell cancer 30%, small cell lung cancer 15%, and LCC almost around again 15%. So most common is adeno-CA, which is most commonly associated with non-smokers. And squamous cell cancer, small cell lung cancer, and large cell cancer, these three are associated with smoking. Smoking, smoking, smoking. Of these three, squamous cell cancer and small cell lung cancer, these two are central. Okay, these two are central. SCC and SCLC, these two are central. Whereas the other two, that is large cell cancer and adeno, they are mostly peripheral. Now, SCC, smoking and men. Adeno-CA, non-smoker, female. Now, paraneoplastic syndromes that are associated with SCLC and SCC. See, all the paraneoplastic syndromes are associated with SCLC. SIAD, syndrome of inappropriate ADH secretion, Cushing, Lambert-Eaton myasthenic syndrome. In SIAD, we know that there is increased ADH. So I sometimes call it syndrome of increased ADH. Anyway, syndrome of inappropriate ADH, Cushing, Lambert-Eaton myasthenic syndrome. These three are more associated with SCLC. What is associated with SCC? Which paraneoplastic syndrome? It is hypercalcemia. See, hypercalcemia happens in this condition due to the increased production of parathyroid hormone related peptide. This causes the hypercalcemia in SCC. Another paraneoplastic syndrome which is associated with SCC is hypertrophic pulmonary osteoarthropathy, which is a rare, but hypertrophic pulmonary osteoarthropathy is the second paraneoplastic syndrome that you have to remember for SCC. Now, let's now learn this thing. So in this you see SCLC has the poorest prognosis and LCC also has a poor prognosis, whereas SCC and adeno-CA, they're better. SCC has intermediate prognosis, adeno-CA has the best prognosis. Okay. Now in histopathology, what we see in adeno-CA, we see TTF1 and napsin A. See, for SCLC and for LCC, it is very easy to diagnose in histopathology. LCC, it is very poorly organized. There is no maturity of the cell. It is completely undifferentiated. SCLC may be same hota hai. There are very small hyperchromatic cells, and the cytoplasm is extremely scanty, very scanty cytoplasm, and hyperchromatic cells which are very small inside. एडेनो सी एंड एससीसी में भी क्या रहता है, एससीसी में आपको केराटिन पल्स दिखेंगे, वेरी इजी. एडेनो सी में आपको डायग्नोस करने के लिए ज़रूरत पड़ सकता है इम्यूनोहिस्टोकेमिस्ट्री की. सो रिमेंबर दैट TTF1 एंड नैप्सिन ए इज सीन इन एडेनो-CA, द मोस्ट कॉमनेस्ट टाइप ऑफ CA. एडेनो-CA में कौन सा मिलता है, ये क्वेश्चन पूछ सकता है. TTF1 एंड नैप्सिन ए. और SCC में क्या मिलता है, P40 CK 5/6. Okay, TTF1 and napsin, remember at least these two adeno-CA में. Now genetics हम देखते हैं, molecular pathogenesis. So EGFR, KRAS and ALK ROS RET fusion gene, these three are seen in adeno-CA. Most commonly EGFR is seen. Okay, this is the most commonest in adeno-CA. Out of the three, EGFR, KRAS and ALK ROS RET fusion gene, EGFR is most common. TP53 seen in all the four types of lung cancers. RB1 universal in squamous in small cell lung cancer, SCLC. So this question, which gene mutation is universal in SCLC, RB1? Which is the most commonest gene mutation associated with the adeno-CA out of the 3 EGFR, KRAS and TP53, it is EGFR mutation. ठीक है. ALK gene mutation most commonly seen with adenosine. ALK ROS rate fusion gene, adenosine. EGFR, KRAS, P53, P53 all cancer type, and EGFR KRAS में EGFR is most commonly seen with adenosine. KRAS is seen with adenosine, but EGFR is most common. Now the next topic we will study is the treatment. So the treatment part, see, surgery, radiation, chemo, we all know. Which kind of chemo we give? Platinum based chemotherapy, right? This platinum based chemotherapy, they are used in 3 places: lung, testis and ovary. Major 3 sites where we use a platinum and where the drugs are very effective. We have 2 drugs in the platinum: cis and carboplatin, right? Out of the two, cisplatin is the older one, carboplatin is the second generation drug. This carboplatin was added to reduce the toxicity of cisplatin. Last drug in the platin group is oxaliplatin, but this is not used in the conditions where the other platinum drugs are used, that is lung cancer, testicular and ovary. Oxaliplatin is used for colorectal cancer, colorectal CA. Cisplatin, carboplatin, oxaliplatin. Cisplatin, carboplatin used for lung, testis and ovary. Carboplatin has lesser toxicity. Oxaliplatin is used for colorectal CA. The chemotherapy that we use for non-small cell lung cancer versus small cell lung cancer. See, in non-small cell lung cancer, we use cis combined with pemetrexed. And in SCLC, we combine cis with etoposide. That too, cis pemetrexed is preferred for adeno-CA. This combination is preferred for adeno-CA. Cis plus gemcitabine. This combination is preferred for squamous cell carcinoma. This combination is preferred for adeno-CA. The patient is not able to tolerate cisplatin, we change with carboplatin. Okay, so for adenocarcinoma we give cisplatin with pemetrexed. For squamous cell cancer we will give gemcitabine, and for small cell lung cancer we give etoposide along with cisplatin or carboplatin. Okay, and remember that the squamous cell lung cancer is a neuroendocrine tumor, right? This is the only one that is the neuroendocrine out of the 4. Okay, so now other than chemotherapy, radiation is preferred for small cell lung cancer. So cis plus eto plus radiation, concurrent radiation is must in small cell lung cancer because highly aggressive. Now coming to the other treatment, we have the targeted therapy. Okay, we have EGFR inhibitor and ALK inhibitor. Most important, EGFR and ALK inhibitors. This is why we were studying about the genes, EGFR and ALK inhibitors. Okay, and they will be most effective for adenosine, obviously. Okay, now immunotherapy, the next category. Immunotherapy में we have the immune checkpoint inhibitors. Okay, ये इकलौता कैटेगरी है यहाँ पे immunotherapy में. Immune checkpoint inhibitors, ICI. What are the 3 ICIs? We have PD1, PDL1 and CTLA4. PD1 stands for programmed cell death, protein 1. PDL1 stands for programmed cell death, ligand 1. PD यानी programmed death. तो किसका death? Obviously cell का death. So programmed cell death, protein 1, programmed cell death, ligand 1, and CTLA4. CTLA, that stands for cytotoxic T lymphocyte A4 associated protein 4. Cytotoxic T lymphocyte associated protein 4. Now the drugs in this. So we have these 5 drugs: nivolumab, pembrolizumab, atezolizumab, durvalumab, and the CTLA4 inhibitor drug ipilimumab. But मैंने यहाँ पे नाम नहीं लिखा because it is less used. These 2 are actually used They are concurrently used with these drugs in SCLC. Not like I'm teaching when these drugs are not used. Okay, so PD1, PDL1, and CTLA4. CTLA4 inhibitor is ipilimumab. This is the mnemonic, and now you will remember them. Panda kills lung cancer. These are the drugs which are immunotherapy. Immune checkpoint inhibitors. Three categories: PD1 inhibitors, PDL1, and CTLA4. What is Panda? P for pembrolizumab, the most commonly used drug. Pembrolizumab. So pembrolizumab, atezolizumab, nivolumab, durvalumab, and anti-CTLA4 ipilimumab. Pembrolizumab, atezolizumab, nivolumab, durvalumab, anti-CTLA4 ipilimumab. Pembrolizumab and nivolumab, they are the PD1 inhibitors, and these two are PDL1 inhibitors. Whenever a patient has uh, metastatic NSCLC, pembrolizumab must be added. So we are using the drugs, we are giving we are doing the surgery, the tumor is removed, suppose. We've added chemotherapy. What was the chemotherapy used for NSCLC? We have two categories: adeno-CA and squamous cell cancer. For adeno-CA, we were using cis and pemetrexed, and for the squamous cell cancer, we were using cisplatin and gemcitabine. Now, suppose this has turned out to become a metastatic NSCLC. Now we will add pembrolizumab also. Now, coming to the staging, okay, classification it is the TNM staging. कौन देता है TNM staging? Tumor node metastasis staging. AJCC, American Joint Committee on Cancer. Sorry, दूसरा नोट खुल गया. 1 second. I have to get back to this. Okay, yes. No. So the American Joint Committee on Cancer gives this classification. So stage है हमारा है 1A, 1B, 2A, 2B, 3ABC, 4A, 4B. इजी कर लिखा हूँ मैं. 1A, 1B, 2 का है A, 2 का है B, 3 has A, 3 has B, 3 has C, 4 has A, 4 has B. तो ये चार ये ग्रुप्स हैं. ओके, एंड सबसे ईजी है 4 डायग्नोस करना. 4 में आपको मेटास्टेसिस मिलेगा. M1A और M1B अगर आपको मिल गया, दिस इज 4A. अगर आपका M1C हो गया, देन इट इज 4B. आई एक्सप्लेन व्हाट इज M1A, M1B later. ओके, अगर M1A, M1B है तो ये 4A हो गया. अगर M1C है तो 4B हो गया. इस वक्त हमें T एंड N देखने का कोई ज़रूरत नहीं है. सो 4 डायग्नोस करना सबसे ईजी है, क्योंकि बाकी सब जगह पे M0 होगा. अब कौन सा ईजी है डायग्नोस करना? 1A, 1B एंड 2A तक बहुत ईजी डायग्नोस करना, क्योंकि सिर्फ हमें T देखना पड़ेगा. 1A, 1B एंड 2A में क्या देखेंगे हम? ओके, आई विल शो यू. सी, 1A हैज़ अगेन 3 कैटेगरी. ठीक है, बाकी कहीं पे क्लासिफिकेशन फर्दर नहीं है. 1A में फर्दर 3 क्लासिफिकेशन है. 1A1, 1A2, 1A3, और फर्दर कहीं पे नहीं है. सो वी हैव 1A1, 1A2, 1A3, 1B, 2A, 2B, 3A, 3B, 3C, 4A, 4B. ओके, सो 1A1, 1A2, 1A3, 1B, 2A. यहाँ तक एकदम ईजी है, क्योंकि हमें NM इन्वॉल्व नहीं होगा. NM यहाँ तक इन्वॉल्व नहीं होता है. इसके बाद NM इन्वॉल्व होगा. ठीक है, सो 1A1 में T1A, उसके बाद वाले में T1B, उसके बाद वाले में T1C, नेक्स्ट वाले में T2A, नेक्स्ट वाले में T2B. T1A, T1B, T1C, T2A, T2B. हमारा 1A1, 1A2, 1A3, 1B, 2A हो गया. नेक्स्ट अब हमारा ये टफ पार्ट स्टार्ट होता है. 2B, 3A, 3B एंड 3C वाला पार्ट. सो 2B में देखो क्या है कि नोट से इजीली याद रख सकते हो. फर्स्ट, इन 2B देर आर 2 ग्रुप्स. फर्स्ट ग्रुप इज हैविंग N1, नेक्स्ट वाला है N0. फिर इन 3A वी हैव 3 ग्रुप्स, N2, N1, N0. देन इन 3B वी हैव अगेन 2 ग्रुप्स, N3, N2, एंड 3C में ओनली 1 ग्रुप, N3. तो यहाँ पे ये इजी हमें याद रखना है. व्हाट वी हैव टू रिमेंबर इज दैट इन 2b देयर आर ओनली 2 ग्रुप्स. 2b हैज 2 ग्रुप्स. 3a हैज 3 ग्रुप्स. 3b हैज 2 ग्रुप्स. 3c हैज 1 ग्रुप. 2b यहाँ से हमें टफ हो रहा है. 2b हैज 1 ग्रुप. 3a हैज 2 ग्रुप्स. 3b has 3 groups. 3c has again 1 group. 2b has 2 groups. क्या लिखा मैंने? 2b में 2 groups, sorry. 2b has 2 groups. 3a has 3 groups. 3a has 3 groups. 2b has 2b बोलो. 3b has 2 groups, and then 3c has 1 group. 2 3 2 1. तो 2 कैसे बनाना है? अब हमें क्या करना है? 2 में लाना है n1 n0. इस वाले में n2 n1 n0. Next we'll go n3 n2, and next we'll go only n3. See, as we are going down the stage, तो जो फर्स्ट नोड न्यू नोड का स्टेज है वो बढ़ रहा है. n1 यहाँ पे n2 से स्टार्ट हो रहा है, यहाँ पे n3 से स्टार्ट हो रहा है. n3 होगा यहाँ पे क्योंकि n4 होता नहीं है. वी हैव ओनली n0 n1 n2 and n3. So 2b has 2, 3a has 3, 3b has 2, 3c has 1. 2 3 2 1. Up till 2a it was very easy, right? जस्ट T1A T1B TC T1C T2A T2B यही था. देन स्टार्ट होता है तुम्हारा 2B. 2B में होगा 2 3 2 1. 2B 3A 3B 3C 2 3 2 1. एंड सो दैट इज वाई n1 n0 n2 n1 n0 n3 n2 n3. यहाँ पे स्टार्ट हो रहा है n1 से, यहाँ पे स्टार्ट हो रहा है n2 से क्योंकि ये एक लेवल ज़्यादा है 3B से. फिर उसके बाद वाला एक लेवल क्योंकि उससे ज़्यादा है तो ये n3 से स्टार्ट हो रहा है. एंड उसका लेवल नेक्स्ट वाला क्योंकि उससे ज़्यादा लेवल जा नहीं सकते तो n3 में लिमिट हो जाएगा. एंड देयर इज ओनली 1 लेवल इन दिस. सो नाउ सी in 3b we have 2 levels, so n1 n0. Then in 3a we have 3, n2 n1 n0. Then next group we have only 2, n3 n2, and the last group we have n3. अब इसके अकॉर्डिंगली ट्यूमर स्टेजिंग होगा. n1 में t1 t2 एंड n0 के अकॉर्डिंगली t3. ठीक है. फिर इसमें t1 t2 t3 t4. यहाँ पे सिर्फ t1 t2 t3, यहाँ पे t1 t2 t3 t4 क्योंकि यहाँ पे 3 है. यहाँ पे सिर्फ 2 t1 t2 एंड t3 t4 एक साथ में. लास्ट पे यहाँ पे सिर्फ एक ही होगा t3 to t4. सो t1 to t2 t3, t1 to t2 t3, t1 to t2 t3 t4, t1 to t2 t3 t4. Here it is t1 t2 t3, and next it is t1 to t2 t3 to t4, and lastly t3 to t4. All right, so this is the classification, and I hope that was tough to you. I think it was also tough to me. Thank you.